Let's first understand why there is nutritional deficiency in diabetics. In type 2 diabetes, the body becomes resistant to insulin, the hormone that helps move glucose from the bloodstream into cells. As a result, sugar builds up in the blood while cells starve for energy. This imbalance starts a domino effect that impacts nearly every system in the body. The situation becomes even more complicated once medications, diet, lifestyle, inflammation, and nutrient loss come into play. Let's begin with medications. In the US, the most commonly prescribed medication for type 2 diabetes is metformin. It works by reducing glucose production in the liver and improving insulin sensitivity. But here's the downside. Long-term metformin use reduces vitamin B12 absorption by interfering with a protein called intrinsic factor in the gut. Up to 30% of long-term users have low or borderline B12 levels, which can lead to nerve damage, fatigue, and memory issues, especially concerning since diabetic neuropathy is already a risk. Other medications like sulfonylureas push the pancreas to produce more insulin, which can lead to hypoglycemia and increased oxidative stress. SGLT2 inhibitors, which make the kidneys excrete glucose through urine, can also increase the loss of electrolytes like magnesium, sodium, and potassium, worsening nutrient depletion. Now on to diet. In theory, diabetics are advised to reduce simple carbohydrates and sugars and instead focus on high-fiber, low-glycemic foods. But in practice, many end up following restrictive low-carb diets that unintentionally cut out essential nutrients. For example, cutting out fruits and whole grains might lower blood sugar, but it also reduces the intake of vitamin C, B-complex vitamins, chromium, and magnesium. If fiber and plant diversity go down, gut microbiome diversity suffers, which further worsens inflammation and glucose control. Plus, highly processed diabetic foods that promise low sugar often replace sugar with artificial sweeteners or processed fats, which offer no nutrients and can damage metabolism in the long run. Body metabolism in diabetes is dysfunctional at multiple levels. The most important is insulin resistance. Insulin isn't just about blood sugar. It's also a signaling hormone for growth, nutrient uptake, and energy balance. In insulin-resistant cells, glucose, amino acids, and minerals like magnesium and potassium don't enter efficiently, leading to both high blood sugar and cell-level starvation. This mismatch creates a vicious cycle. High glucose increases oxidative stress, which worsens insulin resistance even more. Over time, the pancreas exhausts itself trying to pump out more insulin, leading to relative insulin deficiency. At the same time, chronic low-grade inflammation builds up, especially in fat tissue. Inflammatory chemicals like TNF-alpha and IL-6 interfere with insulin receptors, making them less sensitive. Inflammation also consumes antioxidants like vitamin C, E, zinc, and selenium at a much higher rate. For example, studies show that people with type 2 diabetes may have 30 to 50% lower levels of vitamin C in their plasma compared to healthy individuals, even with similar diets. That's because inflammation is constantly burning through these nutrients to put out internal fires. Meanwhile, the body starts accumulating advanced glycation end products, AGEs, sticky compounds formed when sugar binds to proteins and fats. AGEs damage blood vessels, organs, and nerves, fueling complications like retinopathy, kidney damage, and neuropathy. Now let's talk about natural deficiencies. Even before someone is diagnosed with diabetes, many of the key nutrients involved in sugar metabolism may already be low. Magnesium, for example, is involved in over 300 enzymatic reactions, including insulin signaling. Yet around 75% of Americans, and up to 90% of diabetics, consume less than the recommended amount. Magnesium is lost through urine in diabetes, and low magnesium further worsens insulin resistance, creating another feedback loop. Chromium helps insulin bind to cells and push glucose inside, but it's found in very small amounts in food and is easily lost during food processing. Deficiencies are common in both the general population and even more so in diabetics. Zinc is critical for insulin storage and secretion, and diabetics lose zinc through urine at significantly higher rates. Vitamin D, which helps with insulin sensitivity and immune function, is deficient in up to 80% of type 2 diabetics. High blood sugar itself damages the body silently every single day. Excess glucose leads to microvascular and macrovascular complications, slowly weakening the smallest blood vessels in the eyes, kidneys, and nerves. It also thickens the blood, slows circulation, and reduces oxygen delivery to tissues. That's why wounds heal slower and infections spread faster in diabetes. And because sugar binds with proteins, it alters the structure of enzymes, collagen, and even hemoglobin, reducing their function. This causes a buildup of stiffness in arteries and joints and adds fuel to chronic inflammation. That's why keeping blood sugar levels in range is so crucial. Not just to feel better but to avoid long-term complications that begin at the cellular level. All these factors, medication, nutrient loss, inflammation, high sugar, poor absorption, combine to make diabetes one of the most nutritionally draining conditions. Even with a decent diet, diabetics may not absorb or retain nutrients effectively, especially if they're losing vitamins through urine or fighting constant oxidative stress. That's why micronutrient testing, targeted supplementation, and a diet rich in whole foods, fiber, and antioxidants are becoming more important than ever in diabetes care. The real goal isn't just lowering glucose but rebuilding the body's resilience from the inside out, cell by cell, nutrient by nutrient. Now let's talk about diabetes-specific foods. The best diet for diabetics isn't about restriction. It's about precision nourishment. Every food choice either fuels healing or feeds dysfunction. For a diabetic, the goal is to stabilize blood sugar, reduce inflammation, restore insulin sensitivity, and replenish depleted nutrients. And to do that, every category of food must be thoughtfully selected, not only for its glycemic impact, but also for its nutrient density, bioavailability, and metabolic influence. Let's begin with fruits. Diabetics often fear fruit due to natural sugar, but not all fruits behave the same. The best fruits are low glycemic, high in fiber, rich in antioxidants, and contain compounds that actually improve insulin sensitivity. Top-tier fruits include berries like raspberries, blackberries, and blueberries, which have anthocyanins that slow glucose absorption and improve pancreatic beta cell function. A 2021 study found that regular consumption of berries led to a 15% reduction in post-meal glucose spikes in type 2 diabetics. Guava is another diabetic powerhouse. It's rich in vitamin C, folate, and dietary fiber, while its low glycemic index makes it ideal for glycemic control. Papaya, when eaten in moderation, helps with digestive enzymes and is rich in carotenoids that reduce oxidative stress. Green apples, kiwis, plums, and cantaloupe are also solid choices in small portions. Fruits should be paired with protein or fats, like a few walnuts with berries, to slow sugar release. When it comes to vegetables, non-starchy options are foundational. Think dark leafy greens like spinach, kale, and chard, cruciferous vegetables like broccoli, cauliflower, and cabbage, and colorful produce like bell peppers, radishes, and carrots. These are rich in magnesium, potassium, folate, and phytonutrients like sulforaphane, which activates the body's detox pathways and reduces insulin resistance. Fiber is key. It feeds the gut microbiome, which regulates glucose. Fermented vegetables like kimchi, sauerkraut, and pickled cucumbers help populate the gut with beneficial bacteria that reduce inflammation and improve blood sugar. Avoid overcooking vegetables as this breaks down fiber and spikes glucose more quickly. Whole grains can be included, but only true whole grains, not refined versions labeled whole wheat. The best choices are steel-cut oats, quinoa, buckwheat, amaranth, and wild rice. These contain resistant starch and slow-digesting carbs that maintain blood sugar levels. For example, buckwheat contains dyro and oidal, which improve insulin function. Stick to small portions, half a cup per meal, and always combine with protein and fat. Sprouting or soaking grains overnight reduces anti-nutrients like phytic acid and increases magnesium and zinc bioavailability. For breads, sourdough made with whole rye or sprouted wheat is one of the best options. The fermentation process reduces glycemic load and enhances mineral absorption. A slice of properly fermented sourdough raises blood sugar 40 to 60% less than standard white or whole wheat bread. Flax seed bread, almond flour bread, or low-carb tortillas made from coconut flour can also be great alternatives. When it comes to rice, diabetics should avoid sticky white rice varieties. Black rice, also known as forbidden rice, is rich in anthocyanins and has a lower glycemic response. Wild rice is technically a grass and has more protein and fiber than regular rice. Parboiled rice or cooled white rice that's been refrigerated after cooking forms resistant starch, which slows glucose release and feeds beneficial gut bacteria. Pairing rice with vinegar or lemon juice also lowers its glycemic index. For proteins, both plant and animal sources are essential but must be high quality. Fatty fish like salmon, sardines, and mackerel are loaded with omega-3 fatty acids that lower triglycerides, reduce inflammation and protect the heart, a key concern in diabetes. Eggs, especially pasture-raised, provide choline and B12, which are vital for nerve function. Lean meats like grass-fed beef, bison, and organic chicken thighs offer highly bioavailable protein and heme iron, crucial for diabetics with anemia. But processed meats, like bacon and sausages, should be avoided, as they're linked to increased insulin resistance and gut dysbiosis. In plant-based proteins, lentils, chickpeas, and black beans are excellent choices. They're rich in fiber, magnesium, folate, and polyphenol. These legumes lower A1C when consumed regularly, though portion control is critical. Half a cup per serving, and they should be soaked overnight to reduce lectins. Tofu and tempeh are great soy-based options. Fermented tempeh in particular helps improve insulin sensitivity and gut health. Fats are crucial, not enemies. Diabetics need healthy fats to stabilize glucose and reduce cravings. The best fats come from avocados, extra virgin olive oil, nuts, especially walnuts and almonds, chia seeds, flax seeds, and coconut oil. These fats lower the glycemic impact of meals and improve cholesterol ratios. Butter from grass-fed cows in small amounts is okay. But avoid seed oils like canola, soybean, and corn oil, which are highly inflammatory. Spices and herbs are secret weapons. Cinnamon improves insulin sensitivity. 1 to 3 grams daily can lower fasting glucose by up to 10 to 29%. Fenugreek, turmeric, black cumin, and berberine-rich herbs mimic insulin and reduce sugar spikes. Garlic and onions also support liver detox, lower inflammation, and provide trace minerals like selenium and manganese. Drinking herbal teas like cinnamon, green tea, or fenugreek tea helps lower post-meal glucose. Dairy should be chosen with care. Full-fat fermented forms like Greek yogurt and kefir support the microbiome and offer probiotics and calcium. Low-fat dairy often adds sugar or removes beneficial fats. Cheese in moderation, like feta, parmesan, or goat cheese, is better tolerated and provides high-quality protein without glucose spikes. Let's not forget about hydration. Dehydration worsens insulin resistance. Diabetics should drink plenty of mineral water, herbal teas, or lemon-infused water. Avoid fruit juices, even natural ones, as they contain concentrated sugar without fiber. Meal timing and composition matter. Diabetics benefit from 3 consistent meals spaced 4 to 5 hours apart with no snacking in between. This improves insulin sensitivity and metabolic flexibility. Each meal should include a non-starchy vegetable, a source of protein, a healthy fat, and a small amount of complex carb if needed. Ultimately, the best diabetic diet is not about deprivation but precision balance, rich in fiber, color, and nutrients while being low in processed carbs and inflammatory oils. It's a diet built for cellular healing, not just sugar control. When done correctly, this approach doesn't just lower blood sugar. It reverses insulin resistance, restores energy, and rebuilds the foundation of health from the inside out. Now let's talk about diabetes-specific supplementation, vitamins, minerals, and herbal solutions. When it comes to managing diabetes at a deep cellular level, diet alone, while foundational, isn't always enough. Years of elevated blood sugar, medication use, oxidative stress, and inflammation leave behind widespread micronutrient depletion, gut imbalances, mitochondrial dysfunction, and nervous system wear and tear. That's where targeted supplementation becomes a game changer. Not just random pills but evidence-based condition-specific nutrients that support the exact organs, enzymes, hormones, and cellular pathways impaired in type 2 diabetes. Let's begin with the core micronutrients that are consistently depleted in diabetics, either through excessive urination, poor absorption, medication interactions, or chronic inflammation. Magnesium is the master mineral. Over 80% of diabetics are deficient, according to national data. It's essential for insulin receptor sensitivity, glucose transport, energy production, nerve health, and muscle relaxation. Magnesium deficiency increases insulin resistance, worsens A1C, and promotes vascular calcification. The most bioavailable forms are magnesium glycinate, gentle on the stomach, good for nerves and sleep; magnesium malate, great for fatigue; and magnesium threonate, crosses the blood-brain barrier to protect cognition. Dosage: 300 to 500 milligrams daily. Zinc is next. Zinc is vital for insulin synthesis, storage, and release, and it acts as an antioxidant that protects pancreatic beta cells. Diabetes increases urinary zinc loss, and many type 2 diabetics show 20 to 40% lower serum zinc levels. Supplementing with 15 to 30 milligrams of zinc picolinate or zinc bisglycinate per day improves insulin sensitivity and wound healing, especially foot ulcers. But it should always be balanced with 1 to 2 milligrams of copper, since long-term zinc can suppress copper absorption. Chromium picolinate is one of the most studied trace minerals for blood sugar regulation. It enhances insulin action and reduces glucose intolerance. A dose of 200 to 600 micrograms daily has been shown to lower fasting glucose and improve lipid profiles. Chromium deficiency is more common in older adults and those eating high-sugar diets. For those with stubborn sugar cravings or fatigue, chromium can help normalize glucose swings. Vanadium, particularly vanadyl sulfate, mimics insulin's function by activating insulin receptors and promoting glucose uptake into cells. Though its oral bioavailability is low, less than 5%, consistent low doses of 1 to 5 milligrams daily have shown improvements in fasting glucose and post-meal spikes. It's most effective when paired with chromium, magnesium, and benfotiamine. Benfotiamine, a fat-soluble form of vitamin B1, protects against diabetic neuropathy, retinopathy, and vascular damage by preventing advanced glycation end products, AGEs. These harmful sugar-protein compounds stiffen tissues and worsen inflammation. A dose of 300 to 600 milligrams daily supports nerve regeneration and blood vessel health, especially in cases of numbness, burning feet, or vision issues. Vitamin D3, often critically low in diabetics, plays a role in insulin sensitivity, immune modulation, and beta cell survival. Levels below 30 nanograms per milliliter are associated with higher A1C and insulin resistance. Supplementing with 2,000 to 5,000 IU daily, with K2 for balance, improves insulin function, reduces inflammation, and lowers the risk of infections, especially during winter months. Vitamin B6, P5P form, and B12, methylcobalamin, are essential for nerve repair and preventing neuropathy. Metformin, one of the most prescribed diabetes medications, depletes B12, increasing the risk of tingling, numbness, memory loss, and even depression. Supplementation with 1 to 5 milligrams of B6 and 500 to 2,000 micrograms of B12 methylcobalamin daily is often necessary for nerve regeneration and cognitive health. Alpha-lipoic acid, ALA, is one of the most powerful antioxidants and insulin sensitizers. It regenerates other antioxidants like glutathione and vitamin C while also reducing neuropathic pain. Studies show that 300 to 600 milligrams per day can reduce burning pain and numbness in diabetic neuropathy and improve mitochondrial energy. The R-alpha lipoic acid form is more bioavailable than the standard version. CoQ10, especially the active form ubiquinol, supports mitochondrial energy production and combats oxidative stress. Diabetics tend to have lower levels due to statin use, inflammation, and poor mitochondrial function. Supplementing with 100 to 200 milligrams daily supports heart health, improves energy and may help regulate blood pressure and blood sugar. Berberine, a compound extracted from plants like golden seal and barberry, has been shown to be as effective as metformin in lowering blood sugar in several head-to-head studies. It activates AMPK, the master regulator of metabolism, and improves insulin signaling, gut microbiome health and fat metabolism. A dose of 500 mg 2 to 3 times daily before meals helps lower A1C, triglycerides and inflammation. It also has antimicrobial benefits, aiding gut health. Cinnamon extract, particularly Ceylon cinnamon, improves glucose uptake by cells and slows carbohydrate breakdown. A daily dose of 1 to 3 grams can lead to 10 to 29% reductions in blood glucose levels, especially when taken before high-carb meals. Combining it with chromium and ALA enhances its effects. Fenugreek seeds, rich in galactomannan fiber and 4-hydroxylysine, slow carbohydrate digestion and improve insulin sensitivity. In studies, 5 to 10 grams per day in powder or capsule form lowered fasting blood sugar and improved glucose tolerance. Gymnema sylvestre, known as the sugar destroyer, helps reduce sugar absorption in the gut and regenerate pancreatic beta cells. In one trial, participants taking 400 mg per day for 18 months were able to reduce or discontinue insulin. It also reduces sugar cravings by blocking sweet taste receptors. Bitter melon, rich in polypeptide P, acts like plant-based insulin. Extracts have shown significant reductions in fasting glucose levels, sometimes by over 25% in human studies. A daily dose of 500 to 2,000 mg of standardized extract can improve glycemic control when taken before meals. Resveratrol, found in grapes and berries, improves insulin sensitivity, mitochondrial function and endothelial health. A dose of 100 to 250 mg daily can reduce inflammatory markers and A1C over time. Curcumin, the active compound in turmeric, lowers blood sugar by reducing inflammation, improving insulin receptor activity, and protecting the pancreas from oxidative damage. Bioavailability is a challenge. Look for liposomal or piperine-enhanced curcumin at 500 to 1,000 mg daily. Probiotics are often overlooked but crucial. Dysbiosis, or imbalanced gut flora, worsens insulin resistance and systemic inflammation. Diabetics benefit from strains like Lactobacillus rhamnosus, Lactobacillus plantarum, and Bifidobacterium lactis. These should be taken in doses of 10 to 50 billion CFU daily. Probiotic-rich foods like kefir, kimchi, and sauerkraut should also be staples. Finally, electrolytes like potassium, sodium, and chloride are essential when blood sugar is high or during low-carb or ketogenic diets. Potassium-rich foods like avocados, leafy greens, and coconut water powder support cellular hydration and heart function. Sodium is needed in the right balance, not avoided entirely, as it regulates blood volume and insulin signaling. But remember, supplements are not magic pills. Their power lies in synergy. When combined with an anti-inflammatory diet, stable sleep, stress control, and movement, they amplify healing, accelerate glucose control, and reverse the root imbalances that fuel diabetes. The body doesn't just need sugar lowered, it needs restoration, regulation, and nourishment at every level. Supplements, when chosen wisely and used consistently, are one of the most powerful tools to do just that.